working for the World Health Organization, UNAIDS, and the World Bank. And then I went to Mexico, where I worked for the National Institute of Public Health for about 11 years. And there I ran a center that did a lot of evaluation of major health programs and also a lot on HIV, because I've been an AIDS guy since the beginning of my research work. And then I was recruited to the Gates Foundation to run their HIV program, and for a while also the TB program, and was very involved also in our programs in China and India. And then,
So you've seen the world through Gates.
well, I lived in the Congo before that. I'd worked a lot in Africa, and the last 11 years in Mexico. So I've been lots of different parts of the world. Never worked in Eastern Europe. And then after 4 years of the Gates Foundation, this extraordinary opportunity came up at Berkeley, and I've been thrilled to be there the last 9 months now, running the School of Public Health. And of course, the School of Public Health, we don't just focus on global health, we also have a very important focus on the health of California, in particular on Northern California.
And I know at the School of Public Health that you have a lot of interplay with the business school and with other organizations like Citrus that are doing a lot of innovation. Can you tell us a little bit about what you have done and what you have in mind for this nexus between health tech? I mean, we are here just a stone's throw from Silicon Valley and public health.
Well, I think there's a huge amount of innovation that is very relevant for global public health. The huge advances we've made in reduction in childhood mortality, for example, is thanks to the magic of vaccines, which of course came out of the biological technology sector.
Even though we're having a little anti-vaccine problem here in the United States right now.
Not just in the United States, in lots of places. It's a major issue in India, for example, where many, many more kids die of vaccine-preventable diseases that needlessly because of the anti-vaccine lobbies. But one of the things I think is most exciting about being here in the Bay Area is the fact that we've got biotech and information technology here at our doorstep. And one of the things that's especially exciting for me at the School of Public Health is that I'm on the campus of an extraordinary university. So you mentioned business, you mentioned Citrus, which is a center that focuses on innovation in information and communication technology and its application to do good. And good, in my case, is good in health. And so they have a major focus on information and communication technology and health. But we've also got bioengineering. We've got city and regional planning that looks at how the built environment and technology in the built environment influences health. We've got connections with journalism and how you communicate about health. The public policy school. I mean, it's extraordinary the number of different connections we've got on the campus and how we can think about not just the creation of new technology, but then the diffusion of that technology. I mean, the public policy school is critical in thinking about how do you influence the political system so that there's adoption early on of new technologies that could be life-saving.
Yeah, it's interesting you mentioned journalism also because there are a couple of very well-known journalists there who write about health, and the role that journalists play in diffusion, I think, is pretty important.
Well, I had lunch the other day with Michael Pollan, for example.
That's who I was thinking of.
Exactly. So, if you think about what's happening in this state with respect to obesity and the consequences of obesity, it's a fascinating state to study those issues because we are also an extraordinarily important agricultural producer. So you can go everything from the furthest upstream, what are we growing in the fields, thinking about the effects of agriculture on health, pesticides on farm workers and everything else, to the food processing industry, to then nutrition, obesity, and the consequences. How do we deal with chronic illnesses? And as a global health person, I worked many years in Mexico. Well, the health problems in Mexico, the number one health problem in Mexico today is diabetes. Consequence of obesity, Mexico recently overtook the US as the most obese country in the world, but our Latino and African American populations in this country are more obese still than the Mexican population is on average. So we share the problems and we share therefore the solutions to those problems with our neighbors.
Well, it's interesting you bring up obesity, and maybe we'll close with that because it is such a global public health issue. And the question that I want to raise to you is, what is the role of the School of Public Health in engaging the industries that unfortunately are very well entrenched in our profiting? I mean, we're all trying to maximize our current profits, but they are profiting from from foods that may be contributing to the obesity problem. Is there a way that the School of Public Health can play a role in kind of the transformation of industry to healthier foods?
It's something I'm personally very interested in, and so are many of my colleagues. It was easier with tobacco because there is no good tobacco product.
But there are good foods.
And there is good food industry, right? So that we need a vibrant and productive industry that transforms food that comes from the field to food that we eat, right? So we don't want to demonize the food industry. But at the same time, the idea that you market sugar-sweetened beverages with Santa Claus to children at Christmas, that's unethical.
Right. Or you put the sugar-filled cereals down on the lower shelf where the little ones can see it and say, "Mommy, Mommy, I need that sugar cereal."
Well, and we market unhealthy foods with toys to children. That's not ethical. We wouldn't let people market cigarettes to our children. We shouldn't let people market unhealthy foods and drinks to our children either. And I think there needs to be a social consciousness that rises around that. And we have many tools, regulatory tools, taxation tools, that we need to start applying more effectively to unhealthy food.